Good afternoon, everyone, and welcome to the COVID-19 update for Monday, November the 16th. Dr. Ezike and I will be joined today by Dr. Michael Kulish, the Chief Medical Officer for Northwestern Medicine's Kishwaukee Hospital in DeKalb, located in Region 1, and Ruth Colby, President and CEO of Silver Cross Hospital in New Lenox, located in Region 7. These healthcare leaders are here today with a simple plea: stay home if you can, and wear a mask if you need to go out. Because what nurses and doctors and healthcare workers are experiencing right now in their hospitals is a crisis as challenging as the one they experienced last spring. These are our frontline healthcare heroes, and they need our support right now. The nation has been swept by a COVID storm that has taken Illinois' positivity rate from low single digits to the mid-teens. And with nearly no mitigations in the states bordering us and no national strategy to reduce the spread, we're in for a very difficult next few months. But there's a lot each of us can do to keep our loved ones here in Illinois as protected as possible. Before this latest wave, we reached our hospitalization peak 6 months ago. As of our most current data, we are today averaging more than 5,200 patients fighting COVID-19 in our hospitals. That's 400 more individuals than at our spring high, and a 70% increase in the last 2 weeks alone. And crucially, not only are we seeing more people coming into our hospitals with COVID, but the rate of increase itself continues to grow at an alarming rate. Our most recent week-over-week percent increase is 3 times what it was in early October. And our doctors, nurses, EMTs, hospital social workers, and respiratory therapists are paying the price. They're exhausted, often working overtime and double shifts. And remember, this is a moment when the entire nation is seeing record highs in hospitalizations, more than at any prior time in this pandemic. That fact is more than a frightening backdrop, because it means that there are no healthcare workers to call in as reinforcements from other states. It means that out-of-state nurses and nurses' assistants who signed up to support Illinois in the spring are busy in their own states. It means that even more than in the spring, we have to step up to support our healthcare workers and do everything in our power to prevent people from contracting COVID-19. We have the knowledge and the tools to accomplish that by staying home, by wearing masks when we must go out, and by avoiding gatherings until we can get to a place where it's safe to come. In the spring, COVID seemed to many like this was a problem mostly for big cities like Chicago or St. Louis, as rural areas had far lower positivity rates, hospitalizations, and deaths. This pandemic, this virus knows no boundaries. What we're seeing now is a widespread problem across every region of Illinois all at once. And let's get something clear. If we wait to take action until our hospitals are full, it will be too late. And countless patients, COVID patients, as well as those with all the other ailments and injuries that bring people to the hospital, will die unnecessary deaths because there aren't enough beds or people to staff them. So we're keeping in close touch with hospitals on an individual, system level, and regional level basis to monitor who is at risk of running out of staff or ICU beds in the next. But I want to be clear. We can't create new staff for a hospital that's filled to the brim. We can't staff more ICU beds if a hospital's personnel get sick outside of work because people in their communities refuse to wear a mask or follow any of the mitigation rules. We need everyone to pitch in so that we can protect our heroes who are on the front lines. In just a moment, you'll be hearing from the two hospital leaders who are here to share their stories of what they're seeing on the front lines in their communities. The regions that are home to their hospitals, Region 1, that's in northwestern Illinois, and Region 7, Will and Kankakee counties, have both long since surpassed the worst COVID-19 hospitalization rates that they ever saw last spring. Region 1 has more than doubled its spring peak, and Region 7 is at 150% of its spring peak. Neither is showing signs of stopping their rise. But these regions are not unique. They are not outliers. This is the story that we're seeing in regional hospital systems all across the state. Deaths are a lagging indicator, meaning that the people who pass away today were likely diagnosed days or weeks ago, and sadly, some portion of the people diagnosed today will, in days and weeks to come, be fighting for their lives in an intensive care unit without the ability to have family with them. Count back several weeks ago and ask if there was a gathering that took place in your neighborhood that could have spread the virus. Then ask yourself if it's worth it to spread the virus at any upcoming gatherings. Knowing that deaths are a lagging indicator, it's all the more concerning that even before winter, we are already seeing the consequences of significantly rising case rates and hospitalizations across the state. And we can expect much worse to come if mitigation measures aren't followed leading into Thanksgiving. We don't want to end up like the Dakotas, for example, which have taken far fewer proactive efforts to reduce the spread and are currently seeing per capita death rates more than twice what we're seeing here in Illinois. You can prevent this, but you have to act now. The consequences of inaction go deeper than just this disease. Every bed in the hospital that a COVID patient takes up is a bed that's not going to treat someone's heart attack, a cancer patient, or the victim of a car crash. Every doctor reassigned to the COVID wing is a doctor no longer available to do an appendectomy, set a broken rib, or monitor newborns. Add on to it that flu season sends tens of thousands of Americans to the hospital every year. Take into account that we have just 1,100 ICU beds open in a state of nearly 13 million people in the middle of a pandemic. Deaths from COVID-19 are up 260% since the beginning of October, when we were averaging 23 deaths a day, and 98% from 2 weeks ago when we were averaging 41 per day. Now we're seeing 81 deaths per day. That means that every day we're averaging another 81 mothers or fathers or children or grandchildren no longer with us, adding to the total of Illinoisans lost, now at more than 11,000, and the number of Americans lost, now at 246,000. With all the other causes of death, we fight like hell to keep people alive. When the number of people dying in car accidents was much higher, we decided to require seatbelts and increase the penalties for those charged with the most horribly negligent crimes like drunk driving with vehicular manslaughter. By doing these things, we significantly reduced the numbers of lives lost. When seasonal flu was much more deadly than today, we implemented a national strategy to provide annual flu vaccine at a low cost or free, and now every corner clinic and doctor's office tries to vaccinate everyone who walks in the door in the fall to bring that number down. Cancer in its various forms takes hundreds of thousands of our loved ones every single year. So we pour billions of dollars into research to someday put an end to this tragic disease. We have to fight against this one too. I know that it is incredibly difficult that we're still living with this pandemic, and it's exceptionally exhausting to think that for all that we've sacrificed, this new COVID storm is taking more and more lives. But we have to remember that we can contain the damage that this is causing, and there will be an end to this. There's a light at the end of the tunnel. There will be an end. This will be over someday. We're seeing incredibly innovative, wonderful news on the vaccine front. Just this morning, Moderna announced outstanding preliminary results of nearly 95% protection for those who were vaccinated. And while the Moderna and Pfizer models both use mRNA technology, Moderna's vaccine can be stored at much lower temperatures, meaning that it could prove especially functional in reaching people who live farther from the hospital. Between the two announcements and the countless incredible public and private sector researchers who fueled it, we have real hope for possible widespread distribution by early spring. Still, that's months away. So we have to let that inspire us not to give up and to take more precautions for ourselves and for our healthcare workers. Let's do all that we can to save lives now so that more Illinoisans, more Americans will be here when the vaccine is here, to get the vaccine and get to the other side of this pandemic. So thank you, and with that, I'd like to turn it over to Dr. Ngozi Ezike.
Thank you, sir. Thank you, and good afternoon. This is the week before Thanksgiving, and I want to remind people that it is not too late to rethink your Thanksgiving Day plans. They need to be more aligned with COVID-19 precautions. We can all see it. Things are getting worse, and so those initial plans that you made several months ago, even several weeks ago, they may need to change. Do your plans include those who are over 60? Do your plans include those who have medical conditions that put them at higher risk? Are some of your intended guests pregnant? You have to be thinking about all of these things before you bring additional people into your home. The best way to share this holiday is virtually. You really have to consider doing it that way. Let's not gamble with a virus that has already stolen from us, robbed us of nearly 11 million people in just 8 months. Since yesterday, 11,632 new cases of COVID have been reported for a total of 585,248 cases in the state of Illinois. This includes reports of 37 additional lives lost for a total of 10,779 deaths in Illinois. Again, these are our neighbors, teachers, religious leaders, grandparents, all of those empty seats around our Thanksgiving table from next week. 5,581 people were reported to be in the hospital overnight with COVID-19, and of those, 1,144 patients were in the ICU and 514 were on ventilators. In the last 24 hours, more than 90,000 tests have been reported for more than 9.1 million tests in Illinois. Everyone's going to tell you the same thing. Our hospitals are on their way to being overwhelmed. Our doctors, nurses, and healthcare workers are already being stretched beyond their limits. I don't know how else to express the importance of personal responsibility. It is each individual's action, my actions, your actions, all of our actions that will dictate our path forward. Don't see it as you're watching this movie and you're sitting back in your chair trying to figure out how the story ends. You are in the movie. You're one of the actors. You're also one of the directors. You get to determine how this show, how this movie plays out. Please write the lines so that it involves people wearing their masks and avoiding situations that promote the spread of this virus. Let's write a script and act out a script that will get us to the end of this pandemic sooner rather than later. We want to see less cases, less hospitalizations, less deaths. We can do that. We can wash our hands, we can wear our masks, we can forego some of these events, even these holiday events. And I won't say forego, we'll celebrate them. Let's celebrate them virtually. You can cook, people who love to cook the food and leave it at the doorstep for people to pick it up so they can still enjoy your culinary expertise. but we have to reverse the course that we're currently on. We are in for a rough ride for the next 3 months or so. Just how bumpy it really gets depends on each of us. Let's hang in there together and be all in for Illinois. Thank you.